Hello everyone. Welcome to a very special live session that we have for you this evening, following on from our very popular webinar that we held a few days ago on holistic fertility care with the Alphazita team. We had a few questions come in and we've had a lot of interest since, so we decided why not come back and answer some of your questions. So any questions that you have about fertility care, whether that is from a medical perspective, a natural perspective, or you're not even sure how you want to look at your fertility planning and solutions moving forward, then you have the perfect situation now to ask a very wide and integrated team. We are all here to answer your questions, and I'm just going to go through a little introduction again about who we are, so you know who you can ask your questions to. And you should have a little Q&A box that you can see on the screen now. So any further questions that you haven't yet had chance to send in, please do that. We'll be checking throughout this time together to make sure that we answer as many as we possibly can. So to introduce the team to you, first of all, we have Dr. Alphazita, who is a medical director at Embryo Clinic and also the co-founder of the Alphazita Fertility Retreat that we're going to be telling you a lot more about later. Also, the other co-founder is Dr. Kannelina Bimpa, who is also a medical doctor and also created this amazing retreat experience that we'll tell you more about soon. Just a little bit tantalizing there. We have Gordana Petrovic, who is a fertility acupuncturist. And we also have Claire Spink, who is a fertility massage therapist, and myself, Sarah Holland, and I am a fertility EFT coach. Also part of the team, but not able to join us this evening, is Rosie Letts, who is a fertility nutritionist, and David Gibbons, who is an embryologist with the Alphazita team. So as you can hear from that very brief introduction, we are an extremely integrated and holistic fertility team that is pretty unusual in the world today. I think most people find that they're either working with an IVF and fertility clinic and having a very medical perspective to their treatment, or they're going out and finding their own natural practitioners, whether that is a nutritionist, an acupuncturist, or whatever else. And they find it very difficult to bring those two worlds together. It may be that the medical doctors don't really understand the natural therapies, and the natural therapists don't always understand the medical treatment that they're going through. So it can feel like a real disconnect. And I think it's time for that to change. And I'm really excited that Alphazita are leading the way in that, and I was very excited to be invited to be a part of that team, and that the emotional part that I offer was recognised as valid as all the physical aspects as well. So I'm sure you're going to enjoy asking your questions and receiving some very well-rounded holistic answers that might be very different from how you've had your fertility looked at before. And remember, this is just the beginning. This is an introductory session to both us, the team, but also to this way of working with your fertility. And if you are interested in this, there is a lovely opportunity that we're going to be talking to you about to come and meet us all in person and work with us at the Alphazita Fertility Retreat. So we'll talk to you about that later with a special offer that we have. But first of all, the team just say hello. I don't know if you can see everyone on the screen, but if everyone says a quick hello, we'll be able to see you all.
Hello. Hello, welcome.
Hello, good evening, everybody.
Hi, everybody.
We're all here, and I can see lots of you are joining live, and I will keep a check on that Q&A box to see what questions come in. But we have had some questions that have already come in beforehand. So we're going to go through those first of all. Lovely to see the range of questions that you're asking. Just bear in mind that when you are asking specific questions about your own situation, obviously we don't have access to all your medical details, your test results and so on. So we may be unable to give you an extremely detailed answer, but we will answer in the best way that we possibly can. Okay, so let's begin. So first of all, we have a question from Rachel. And Rachel said, my husband and I have both had preliminary tests done, blood tests, sperm tests, scan of uterus. They came back normal for our age. She's 36 and he is 39. But we have been trying for 2 years and no luck getting pregnant. So should we try and be referred for IVF, or are there any holistic methods we can try first? Who would like to answer that first? Dr. Sakos, would you like to answer that one?
Yeah, sure, why not? Frankly, the answer is quite simple. in view of the age of the couple and in view of the characteristics, then they need to move forward. After a couple of years of trying, and despite normality of tests, baseline tests, there is a possibility that there is something there, and obviously that couple could be helped. So I think it's time to take the next step for take the next step in the journey, and perhaps identify a team that would look after them. Now, I am referring to a team because perhaps it's not strictly medical. There could be other factors associated with the difficulty of this couple. So it would be nice to find and identify the team that would be suitable with regards to their characteristics. There's only one serious point I would make, which is the point of time. Time is very important in fertility treatment, and the time advantage should be on the side of our patients. So they should not waste any time in identifying the right people to treat them, and the right people to treat them are not just medical and technical people like ourselves. There are other people who would enhance their overall experience and their overall fertility. There are very simple interventions from a team of holistic therapists that would definitely assist that couple in the pursuit of pregnancy.
So when you're talking about those first steps, like you're saying, it's really important to take those first steps forward. Would that be from a medical perspective or holistic perspective, or a combination of the two? What would you think those first steps?
Sure, an absolute combination. I mean, the first step would perhaps be to see the GP and try to get them on board. Number two would be to identify whether that couple would be suitable for IVF treatment on the NHS or not, and find out how long that would take in terms of waiting lists and all that. And of course, when they get a time frame about their treatment, then they can look at other ways of enhancing their natural fertility, which includes stress management, includes nutrition, acupuncture, general lifestyle, and fertility coaching, and so forth.
Okay, thank you very much. A good opening question. Does anyone else have anything they'd like to add to that one about approaching those first steps, walking in to fertility investigations and possible treatment?
Okay, I can say a few words, but I'll build on what Dr. Tsakos said. And in my own clinical practice, how I work and then how I work with the team, I would certainly advise to go and speak to the GP and get referred on, just to see in terms of what is needed in terms of medical tests and investigations that are appropriate to the age and the possible maybe some underlying issues that a couple might divulge at a later date. If I was having such a couple, so this is the first port of call, I would obviously take the history and look into what was happening. In terms of the holistic approach, I would suggest that we look into the lifestyle, like Dr. Tsakos already mentioned, into the lifestyle, and then if there are a few bits and pieces that I would like to go with the lady, with Rachel, in question, just to see how the menstrual cycles are, because sometimes this presents a problem, and sometimes people are just used to having possibly irregular cycles, or maybe they'll say a few days up and down of 28 days or 30 days or whatever, and sometimes they'll just say, oh, my diet is really quite, I leads quite a stressful lifestyle, and I'm doing so much, and all of these elements would contribute possibly to a certain degree to difficulty conceiving. Also, whether the couple spends enough time together, and also whether they are aware of the ovulation sort of window that they have during the month. So just raising the awareness of what else there is to do, aside from obviously doing acupuncture treatments and treating from a Chinese medicine point of view. But my starting point would be, like Dr. Tsakos said, go through some of the investigations, get the GP on board, and then possibly get one or two holistic therapists to go along and to address various aspects of something that might not have been highlighted before. So like simple things, going through the consultation, what has happened and what is stressful and what exactly is the diet like. Of course, that would be scope of Rosie less, but I'm just mentioning that as part of my work as well. And then certainly lifestyle, and whether there is something that can be improved, as well as raising the awareness, whether they know if the ovulation takes part and how long. They should be looking into planning the window of time in the natural concession part.
Thank you so much. So I think that's important, is you can look at like these initial medical tests, but actually it's looking at the wider picture of fertility. So thank you for pointing that out. Thank you very much. So our next question is again a more a medical one. So this will probably be for you, Dr. Sakos. It's from Lila, and she asked, I'm interested in the possibilities of how to increase egg and sperm quality. What do you think about the role of PGS in the IVF process? Is it necessary, or is it better to prepare with improving egg and sperm quality?
Right. Okay. This is, I mean, we could be talking about this for a long weekend. So it's really difficult to give a short answer. And thank you so much for the introduction, Sarah, mentioning that our answers are indicative. They're general answers. They should not be seen as a specific medical advice. And of course, it would be just a generalization advice on patients with similar characteristics. So by no means do not take exactly the specific answers we give for your specific question as absolute, because we haven't seen or haven't examined. In order to be able to address this issue, one would need a good hour to take a history and perhaps another hour to go through investigations and tests and discussions and counseling. So it's not, I will talk generally. Now, the quality of eggs and sperm, this is something that we should all be looking at. As Gordon Petrovich mentioned, it is very important to see the couple together and address some lifestyle issues that could be preventing that quality to be ideal. So smoking, alcohol, substances, lifestyle, shift working, obesity, and stress, of course, may be factors that would affect the quality of both sperm and egg. But the most important factor is age. So although there is something we can do always, so we can always optimize the quality of eggs and the quality of sperms to a certain extent, we can't expect miracles if somebody is 45 or 47 and they wish to have IVF with their own eggs. So what can we do with regards to eggs? Any sort of lifestyle change may be able to improve that quality of eggs. There's lots of microvitamins, there's a lot of micronutrients, and of course the standard advice that we give with regards to substances, lifestyle, exercise, stress, and so forth. And equally with sperm. Over the last few years, there's been a lot of interest over the addition of vitamins or multivitamins in order to enhance that quality. I think that should be seen quite carefully, because vitamins sometimes are quite chemical. So although there is some evidence that they may be of help, for example, inositol for male factor or Q10 enzymes and so forth. However, we don't expect miracles. I repeat. So somebody who's on a terrible nutrition and drinks fizzy drinks and has a bad diet and perhaps is overweight and smokes and drinks, they should not expect a miracle by just taking an expensive 100-pound a bottle multivitamin supplement. So all that should be seen in the context of the holistic approach. And again, a team should be ideal to address and manage those issues. Now, with regards to PGS, again, the scientific community has not come to consensus yet. PGS is the ability to test the embryos before we implant them. It seems that our colleagues across the Atlantic in the US, they're very much pro-PGS, but there's quite a lot of debate as to whether this is for the benefit of the patients overall, whether that would increase the pregnancy chances or not. So this is yet to be proven. Certainly, there are certain indications for PGS, and at the moment, I think in Europe and in the UK, we should be treating with PGS selectively and not as a routine on everybody. But as a conclusion, there's a lot that could be done. We get these answers and we see our patients expecting a miracle answer. We get these questions and they expect a miracle answer. There's no miracle. So, excuse me. There is common sense. There is training, education. We would like our patients to be trained and educated. We would like them to know for themselves what is good and what is not good. And we would like them to be prepared before they take the test. Recently, I was speaking to a couple and they asked me, what is a fertility retreat? What does a holistic team do? And why is it important? And a very simple answer came to my, to my head. And this is very simple. You can't expect somebody to be successful in the A-levels unless they've gone to school. So fertility school, this is what a fertility retreat is. This is what a team of holistic therapists and complementary and conventional therapists do. They dedicate time and expertise. You can never exhaust the subject. You could be talking for hours for PGS. You could be talking for hours, as we all know, for sperm and egg improvement techniques. So the whole idea is to spend time with those patients and spend time looking at them from different angles. So there is hope, there are solutions, and these should be tailored for every couple individually.
Thank you for that answer. And I think that's going to answer a lot of questions for a lot of our listeners about how to approach all these different, like you say, open-ended questions about what will help and what won't help. And it is a matter of, finding out, doing your research and taking those steps forward. I love the idea of patient kind of training or education. And actually I see that as empowerment. It's putting the patient back in the center of this experience rather than feeling like someone else knows all the information. It's good to have a really good understanding of it yourself, so then you can make good informed decisions. So thank you for reminding us of that. We had a question come in. Actually, this one is one that came over from the webinar that we held a few days ago from Rebecca. And she asked us whether we can help someone and support someone who has been through a stillbirth, which I know is a very emotive topic to talk about, but one that does affect a percentage of people who are still trying for their baby. So I thought that would be a good one to talk about here and address, because I know it being a holistic team, looking at fertility in lots of different ways, we'll have different approaches here where we can support someone who has been through a stillbirth. I wondered, Claire, whether you wanted to begin by answering this question.
Thank you, Sarah. Thank you for Rebecca for sending that in, and I really do send you my heartfelt condolences for what you've been through. Stillbirth and any loss, whether it's miscarriage, an ectopic, or a stillborn, or even just when women don't conceive month after month, that's a loss. And what I found in my practice is that every time we go through such a trauma, we disconnect slightly from our body. We hear people say, I just feel like an empty shell. And that's because we're kind of losing part of our soul. So one of the things that we do as part of the fertility massage treatment is a ceremony of wrapping women. It's an indigenous, it's a traditional treatment actually that comes from a lot of indigenous cultures, where they wrap women after they've given birth, because when you give birth, physically you explode out and you give your energy out. But I've brought that treatment in to women or anybody who has experienced loss and trauma, because when we disconnect from ourselves, it's about bringing ourselves back in to be restored. And we actually call it restoring the soul. It's a very simple ceremony that is performed to help kind of just bring all the parts back in and start to piece you back together, to start healing you. Meditations, journeying or visualizations, however you want to, whatever word you want to use, they are also really powerful tools that we can use. And I've used them a lot over the years with women who have had any type of loss, to try and help them to not forget what they've been through, but to release the energy that they've held on to. And release that so that they can bring in positive and fresh new energy, to start being able to ready to call in a new baby soul. It is a very emotive topic, and there are no right and wrong ways that are going to be right for everybody. But I think it's about really having somebody that you can go to where you feel safe, you feel held, you feel secure, to be able to really talk. Because what I do find as well with a lot of clients is their friends don't really understand, and they don't always say the right things. And so having someone who's non-judgmental and just there to hold them, to hear them, is a really important aspect of the healing process. And I'm sure that other members of this panel will have their own ways of working with it, which is why it's great to work with a team. But that's how personally I have worked and will continue to work with women that walk through my door who have experienced that.
Thank you, Claire. And yeah, I knew you'd be the right person to direct this question to. And I think it is that acknowledgement, isn't it, of any loss, like you say, any loss that a woman or a couple have been through on this journey, and what imprint it has left behind, and how it's then influencing them moving forward. With my clients, I often ask them, how do you now feel about carrying on trying to conceive? It may be that they're a place of not even trying yet because it feels too soon, or they feel too afraid of what may happen. And I asked them, how does that feel? That thought of trying again, that thought of seeing another positive test, or the thought of going through a pregnancy again, and visualizing that. And if there's anything that feels blocked, unable to even visualize, or brings up a lot of fear in them, that's something that I'd work with as well, using EFT tapping, just to remove that emotional connection that may be keeping them stuck and unable to move forward and see a different kind of future. So I think you're right, all of us here in many different ways, and also I'm guessing definitely from a medical perspective as well, as whether or not any reason is known for the stillbirth, but moving forward so you feel totally prepared, ready for those next steps. I always think it's good to be prepared before you try to conceive again, and feel comfortable with the idea of pregnancy, rather than trying to kind of push through the fear or push down the feelings, because the body's wise and it will try and protect you and stop anything that feels potentially life-threatening or risky or dangerous. So to leave yourself open and ready for your next pregnancy to come in, I think healing all these aspects are really important. And you can rest assured that as a team we would take that very seriously and be privileged to work alongside you with that. So thank you for asking that question. I'll go back to our question list, and we have some more coming in live now. Remember, if you are listening live, as I see some of you are now, wonderful, do ask your questions. If any thoughts are coming up as you're hearing us speak, just write your questions into the Q&A box and we will get through as many as we possibly can in this time. I have a question here. Let's see, this is a short question, and I don't know if it will have a short answer or a longer answer. I'm guessing it's going to be a little bit open-ended, depending on the history and the medical picture of this person who's asking the question, that we don't know everything yet. But it's from Di. And Di asks, what are my realistic chances of getting pregnant naturally at 48? Dr. Sakos, did you want to begin there?
Yeah, sure, absolutely. Thank you for asking, Di. I will start with a very important fact. The chance of natural pregnancy at your age may be higher than the chance of an assisted pregnancy with IVF. Even if that sounds crazy, this is the case, and I will elaborate a little bit more. The oldest woman in the world who delivered a child after IVF using her own eggs was 46 years old a few years ago, 3 years ago in the US. So this, in a way, has set the time limit, the age limit for own eggs IVF. And I presume this is what you're asking. What is the chance of getting pregnant naturally and versus the chance of using your own eggs to get pregnant? Of course, if you use donor eggs to IVF, your chance is extremely high. And provided that you're healthy, you could be treated anywhere in Europe where the legislation allows treatment until the age of 50. Straight answer, naturally with your own eggs, of course, you may have higher chance of IVF-assisted own eggs. However, the chances are extremely small. There have been recorded pregnancies and deliveries of healthy children of women over 50 with own eggs. Personally, in my experience of 27 years, I have delivered 49-year-olds who conceived naturally. And to be honest, most of them, they didn't realize the degree of rarity that was involved. So there is a possibility. However, in order to elaborate exactly in your case, because obviously it depends on your partner, on his characteristics, on the sperm, on your overall health, on your overall assessment and so forth. So I don't think it's enough to just say it is possible. It is extremely unlikely, but it's not impossible. That would be my answer. And of course, with regards to assisted conception like IVF, then with the use of egg donation, your chances could be extremely high, in the region of 60 to 70% per go. So it is widely known these days that with egg donation, we can bypass the problem of egg quality at the age of 48. And very often we have pregnancies at this, as they call it, extreme reproductive age. So don't lose hope, and it is possible as long as you have the opportunity to be educated and obviously to acknowledge and realize the options.
Thank you. Now we're talking about the potential topic of egg donation. It leads quite nicely into our next question, which are also, I think, as well as answering this from a medical perspective, I think once we start to kind of delve into the area of egg donation, it's good to look at this from an emotional and natural perspective as well, as to how we make that decision and all the other factors that kind of come into play as we move forward to a different route. So this question, a few of us may be able to chip in with this one. We'll see. It's from Alana. She says, I'm 42 years old. I have an 18-year-old daughter. I've had 1 miscarriage and have been trying 10 years. Had 1 IVF, 2 ICSI, and my AMH is 5.1. I've been told that egg donor is my only option. Could this be true? I'm thinking of going to Prague for treatment. So first of all, is there a kind of a medical take on that, Dr. Sakos? Anything else you wanted to add that you didn't include before on the question there about egg donation?
If I can take this question, yes. I mean, we can never say it's the only way forward. I mean, as a doctor, I've always resisted using that term. I think most of us, we've been pleasantly surprised many times by situations where biology is cleverer than us, and nature is more clever than our labs and our fancy equipment and so forth. So I think it's very rarely that there's only one option, or very rarely that we can say, at least a 42-year-old with a normal AMH, that egg donation is the only way forward. Indeed, egg donation may be providing with better chance of pregnancy, but I think it is important overall to be very frank and be very pragmatic when we address those issues, and it is important for the patient to be well informed before they make a decision. So at 42, there's a fair chance of own egg IVF success. A history of 1 failed IVF perhaps should not discourage somebody if they want to explore more the options of using their own eggs. Here, the holistic approach might be helpful in terms of optimizing the quality of eggs, the psychology, the stress levels, the nutrition, the support, and the encouragement those patients need. And if that's the case, then they would be entering the arena of IVF with much better chances of good success and good experience.
Thank you. I know, I expect this is true for all of us, but I know I'm seeing many more women and couples now who are at least considering egg donation. It just seems to increase every year, you know, that this is an option and people are understanding it more, and there's more clinics offering it. And yes, traveling, as this lady mentioned, traveling to Prague or elsewhere in Europe. I'm sure Greece is a wonderful place to travel to. Would I be right? For egg donation?
Yeah, sure.
Yeah. And I think what comes up time and time again, though, is that it's not just a simple decision. It's just not, you know, I've been trying with my own eggs and now I'll just switch to egg donation. You know, it's, in fact, I actually spoke to someone recently where she said at the clinic where she went into one room to find out the negative result of her own eggs IVF treatment. And then they directed us straight into another room to talk about egg donation and start looking through a file of potential donors. And it was just too much, it's a big switch to make. And I think that it's important that people have space and time to air all their worries and fears and unanswered questions, and work through anything that they're not sure about, all the ethics of it, what it means for their family, what it means for the donor, for the child. There's lots of different factors come in, isn't there, with donor treatment that isn't present with own egg IVF, for example. So I think looking at it from a medical perspective, of course, is vital, and that, like you say, that preparation holistically as well, with the good nutrition and so on. But also from an emotional and spiritual perspective, I think is really important. So again, it's why having an integrated team behind you as you make these decisions, big life decisions, is really important, so that you can explore all these different aspects and you don't feel that down the road, maybe during your 2-week wait or whenever it may suddenly come to you, that something is unresolved and something you don't feel quite comfortable with. Like I said with the previous answer, it's good to move ahead with fertility treatment or just trying to conceive again, feeling totally comfortable with that path, and that you're not putting any obstacles or fears in the way. So I just wanted to mention that as we're talking about the topic of egg donation, which I know will bring up all sorts of feelings and thoughts in many of our listeners. Does anyone else have anything they want to add to the whole topic of egg donation and decision making and anything else before we move on to the next one? Or do we have that covered? Yeah, pretty covered. Good. I'm getting affirmative nods, so that's good. Okay, so having a look back at our questions, remember, do keep sending them in if you're listening live. One that has come in live while we're sitting here talking to you is from it's just a username of Clam728. I'm not sure that's your real name, but welcome. And this is what's been written. She says, I have a lot of medical issues, including PCOS and diabetes. I was able to get pregnant twice, but both resulted in miscarriages. Now I've developed liver adenomas from past long-term use of birth control to treat my PCOS. I'm seeing a liver specialist to assess what they can do to help me resolve the issue. I'm 40 years old. My husband is 47. I'm becoming more fearful that we'll not be able to have a child. What else can we do? And I realise that's a very specific medical question, but I'm wondering if there is anything else that can be added to what she's receiving at the moment.
Sure, if I can answer this, Sarah?
Of course, yeah.
Certainly liver adenomas is a fairly serious condition, so I think number one priority is to get those sorted. I'm not sure they are strictly associated with the birth control, so this is something that you need to look into with the help of your liver specialist. So number one priority, see a liver specialist. Number two, ask them if you could be suitable to proceed with a pregnancy overall. Liver condition, especially if liver function has been affected, it may be adversely affected by pregnancy as a condition, whether this is a natural pregnancy or an assisted pregnancy. So number two, get advice and guidance from your liver physicians and your GP as to whether a pregnancy overall is indicated. Hopefully it will be indicated. It may, of course, be a high-risk pregnancy that could be managed accordingly, but that would not exclude you from having fertility treatment, IVF, own eggs IVF, donor egg IVFs, IVF in view of your age and so forth. However, even if the answer that perhaps your liver condition may deteriorate in pregnancy or may compromise your overall health or the health of the pregnancy, there's still options, and those options include the use of a surrogate mother. So even if the risk perhaps to your own health or the risk to the unborn child is high enough for you to decide against a future pregnancy, you can still be treated through surrogacy and still become a mother. So I think you're a typical example where everything looks gloomy and dark, but there's always a lot of opportunity and a lot of options to be discussed. Now, with regards to your background disease, which perhaps is the polycystic ovaries and the diabetes, don't forget, apart from the conventional medicine, don't forget other techniques like acupuncture, like nutrition, like stress therapy, that may help you improve your overall condition. And I will perhaps ask my fellow panelists to take it on from here with regards to what is the place of acupuncture, Gordana, in the treatment and management of polycystic ovaries and diabetes. And of course, Sarah, what is the place of stress management, fertility coaching, and EFT in those conditions?
Okay, yes, thank you, Dr. Tsakos. Yes, one of the very frequently seen cases in our clinical practice as acupuncturists, I know certainly for myself and colleagues, is PCOS, history of PCOS, as well as other gynecological conditions. And it's certainly some success there, in as much as we would be looking again into the lifestyle, diet, and all the other things that are involved in possibly this condition. I would, however, always work with the female medical specialist in this case whenever I have a chance. So again, it's an extremely important fact that we are always best working together, and I do really think that has an incredible value. Acupuncture as a therapy aims to regulate any system that in our bodies is out of balance via inserting fine needles in the body points. I'm sure many of us know about that and how it works, and also working on balancing out the hormones, working out on balancing out the actions of the sympathetic and parasympathetic nervous system, and so on. So it would have an overall effect and improve your health condition quite to a certain degree. Obviously, we'd need to know a full medical history, the duration, and also other elements of your lifestyle and your condition to be able to assess that. But it's certainly, acupuncture has been researched as one of the therapies that does have value in the treatment of the PCOS, as well as other conditions, gynecological conditions, and I do work with that both independently and now as part of the Alphazita team, which is an incredible bonus for all of us. So certainly would recommend trying it out for many different reasons, but certainly for what Dr. Tsakos said, PCOS and diabetes, and that's what the question was about, for sure. Good luck.
Thank you, Gordana. And I know Dr. Tsakos mentioned stress management, fertility coaching. Just one little thing I wanted to bring in that jumped out from me from your message that you wrote was that your last sentence where you said, "I'm becoming more fearful that we may not be able to have a child." And yes, of course, there's ways that we can look at stress management and balancing hormones to assist the balancing that you're looking to do for the PCOS. However, that's the part that kind of jumped out at me. If fear is starting to come into this experience, then I would want to start exactly there. I always say this to my clients: let's start where you are, rather than looking at the detail. Let's start with where you are and what your kind of biggest fears and worries and the thoughts that are at the front of your mind. And if you're feeling very fearful around, will this ever be able to be resolved, I'd like to kind of work with that fear first, so that then you feel, actually, I'm confident moving forward that I will find a solution. And then we're more likely to move forward and look and engage with those solutions. So that's what kind of just jumped out for me from your question. I hope that comprehensive answer has helped you somewhat. And I see that you have actually just sent in another one. Thank you very much. And I see, she says, have you heard of Arvigo massage? Would that work well with acupuncture? Claire, I'm thinking this will be you to answer this question.
Yes, it's probably. Arvigo is very similar to fertility massage in the fact that we treat the same area of the body. We are working on the lower back and all the nerves that feed through from the lower back into the front, and we're working from the pubic bone up to the rib cage. So we're covering all of the reproductive and the digestive areas. And I know that Arvigo works the same areas. We work differently with the body. And so can it help with what you're going through? Yes, it can, especially how Sarah just brought up about the fear. That's the part that actually really stuck out for me as well. is really addressing that fear and how it can be stuck in the body, and working alongside Sarah. I'm sure that that can certainly help to release that held tension that you're holding on to with the fear, but also with getting the circulation around the body, helping the hormones to travel through, helping the detoxification process, but again working alongside a medical team so that we know exactly what we're working with. So yeah, I hope that's answered the question.
Yeah, I think what's key is that there are many different therapies and treatments, aren't there, that can be combined. So can this be combined with acupuncture? Can this be combined with IVF and so on? 9 times out of 10, the answer is yes. But that 1 time out of 10, when it's no, whether it's, a particular herbal treatment or a nutrition combined with another, actually, it's really good to ask these questions and get that advice and make sure that there are no conflicts in different treatments that you're having. So it's really good to ask those questions and make sure that any practitioners that you're working with, whether that's medical, natural, or a combination, are all communicating to each other, are all aware of each other's treatments, and actually have an understanding of each other's treatments as well. It's no good if you ask an IVF doctor, for example, can I use like you say, fertility massage or something, when they have no idea what it even is. How can they possibly answer that question? So if you have a team, as we are, who actually all really understand each other's approaches and learn from each other constantly, and communicate about their patients and approach the care in a joint way, then you can feel safe and secure in your approach then, and you're not going to have these questions that you don't have answers to. So thank you very much for your questions that have been coming in. Feel free to keep sending them in. I think what you'll notice from everything that we've answered so far, and I know it's just made it clear to me again, is that there's a huge breadth and depth to the advice and support that we're able to give you as this truly integrated fertility team. More than I have ever come across, to be honest. I've worked before with natural therapists, but I've never worked in such a truly integrated team. So it's been really lovely to hear those answers that you've all been giving and to be a part of that. And I'm sure that our listeners have enjoyed that as well. Of course, this is a short session that we're able to offer you this evening, and it's online. So we're all over the world, you're all over the world, and we're all trying to come together to support you as well as we can. And we're making the best of this amazing technology that we have to do that. We do have another solution though, and something that is much more personalized, much more in-depth, and will move you from A to B much more quickly than just doing your research online and trying to bring all the pieces together yourself. So if you would like to actually have the support of a team just like us, the Alphazita team, looking at your unique fertility situation individually, looking at all your test results, looking at what you have tried so far, and giving you an approach and support and treatments that are really tailored to what you need, then we have got what we believe is a perfect solution for you. So we're going to just present that to you now. And let me get my first slide up. Here we go. This is your invitation to the Alphazita Fertility Retreat. Now, we mentioned this briefly in our webinar, and we do have a very special offer that we want to offer you as well. So we did think it was worth mentioning it again. We didn't want you to miss out on this unique opportunity to experience working with the whole team in, let's be honest, an idyllic situation where you can truly relax, you can truly focus on your fertility with no other distractions, and come away from this short retreat experience renewed and with a new plan for your fertility. So the Alphazita Fertility Retreat, whoops, I'm just going ahead my slides too quickly there, is taking place next month, the 11th to the 14th, excuse me, I haven't corrected the date on there, it's the 11th to the 14th, a little bit longer than there, of October. And it's at the beautiful 5-star Sani Resort in Halkidiki in Greece. It's just such a perfect situation to be able to focus on what you need and get support from a truly holistic team, which I'm sure by now you can see exactly how we work together in your best interest. So what does the Alphazita Fertility Retreat include? Well, it includes 3 nights luxurious accommodation at the 5-star Sani Resort Hotel, completely all meals and snacks for each of the 3 days that we're together. And from what I've heard, it's very fine dining, and you will really be fed well with good nutrition to support you on your fertility journey. We'll also arrange transfers to pick you up from the airport and to take you back on your departure. That's all included. And then, of course, there is the important part of it, the time that you spend with us as a team, and what you actually achieve from this time together. So you will experience a half day of presentations with the whole Alphazita fertility team. As we said before, we're not all present here this evening, but you will also receive information about nutrition from Rosie Letts as well. And you will also receive personalised consultations as well. So there'll be plenty of time for you to relax and enjoy the surroundings. And then you will have some one-to-one time. So that includes a medical consultation with Dr. Sakos, acupuncture with Gurdana, fertility massage with Claire, nutrition with Rosie, and EFT with myself. So the team that you see here now, you will see us all supporting you as fully as we possibly can in the time that we have together. So I'm sure you can see this is a really comprehensive experience, something that would be impossible to recreate in your hometown, you know, to be able to get all of these treatments together, all of these experts together. But if you make that journey to meet us in Greece, then we'll be really pleased to have you as our guests. Now, we have a very special offer available to you if you were to book this today. Actually, no, we've just extended the offer. It's going to be up until tomorrow as well. So originally you will have heard that we were going to be having this offer available till Monday. Then when we realized we were going to offer this Q&A, we thought we need to give you an extra day to have consider this and see if you would like to join us. So we're pleased to extend the offer right through till tomorrow, Tuesday, the 11th of September. So if you inquire about booking before then, and then go on to make your booking with us, you'll receive a £100 discount on a single booking, a £150 discount for a couple booking. And you'll also receive some lovely bonuses that will really enhance and deepen your experience of the retreat. That will include a 15-minute Skype medical consultation with Dr. Sakos before you even come to the retreat. So you'll have already had that initial consultation. So the further consultations that you have will be very well prepared to speak to you then and know exactly what's going on in your unique fertility situation. You'll also receive a self-help online fertility massage program created by Claire, which means that as well as experiencing that massage with Claire at the retreat, you'll be able to continue the self-care when you get home, which is just the most wonderful gift to give to yourself. Plus some beautiful fertility visualizations that Claire is just they're beautiful. I've heard them myself and they're wonderful. So you'll have those to listen to, maybe listen to them on the flight, on the way home. You'll also receive a 60-minute online fertility EFT session with myself. So that will be a full hour continuing once you get home on any other emotional issues, any difficult situations you're facing, decisions that you're making, emotional blocks that you feel may be there. We can continue to work with those in depth within that hour. And you'll also receive a fertile body guide, complete with recipes, and a 30-minute fertility nutrition consultation with Rosie Letts. So again, lots more support to continue with after the retreat. So I'm sure you can hear that the retreat itself, along with this package, is truly comprehensive. So if you'd like to take advantage of that, you just need to let us know your interest by tomorrow. And the pricing of the retreat is as follows. But as you can see with the discount, it brings it down to just $1,099 for singles, and for couples in a shared room, just $1,549 in total. So these prices are in UK sterling currency, and all these discounts are valid. So if you just make that inquiry by tomorrow. Now, to make that inquiry and to book your place, all you need to do is to send an email to info@alphazita.com. So send us a brief email there, just letting us know you're interested at info@alphazita.com. We'll get back in touch with you really quickly to arrange a short chat to talk through any questions that you have about the retreat and get you booked in if you would like to. As long as you have sent that email by tomorrow, by Tuesday the 11th, then you will absolutely be able to take advantage of the discount and the bundle of extra bonuses that are all available to you. So do get in touch if you would like to join us. Does anyone else here in the team have anything else they'd like to add to that description, or any other benefits that are available by taking part in the retreat here?
Yeah, if I can make a comment, Sarah. It's been a pleasure to have this retreat for the second time in our area, and I would just like to say that it's such an enhancing experience that we've had repeaters. So there is a couple who attended the first retreat, and now they're coming to repeat the experience in the second retreat as well. So I think that in itself is showing how much the couples appreciate what they get out of those 3 days with the team, and how much information, education, support, friendship, and life-changing experience could be drawn out of this truly unique and world's first experience. I mean, I challenge whoever has seen anything like this anywhere else before to share it with us, because I don't think there is such an experience, such a retreat, a fertility retreat at the moment. There are camps for tennis, for nutrition, perhaps for yoga, but fertility camps where people come from all over the world to listen and mingle with specialists from complementary and natural medicine. I think this is pretty unique, and I'm personally very excited to be part of this team. And thank you so much, everybody, the participants, the panelists, for sharing our vision.
Thank you, Dr. Sakos. And Dr. Bimpa, I know that you are very passionate about this retreat as well, as one of the co-founders. Is there anything else that you would like to add about why this is a wonderful step to take for anyone on a fertility journey?
Well, actually, my thought is, I'm thinking about that there are some aspects of this retreat that are not restricted only to fertility, to be honest. I mean, I will join you. I don't have any fertility issues, but I sure would like to have an acupuncture, have a consultation with you, Sarah, and have some nutritional therapy. And I see that there are some aspects that we can take as a benefit and project to the rest, to our whole lifestyle, to the rest of our lives.
So true. It's almost as if it's the fertility challenges that have got us to this place, yes. But now we're here as a whole person, looking to heal the whole person, aren't we? So there are so many benefits to every aspect. You're quite right. So, and even if we have people who want to join us who aren't necessarily experiencing any fertility challenges, but are just at the start of their preconception journey, just preparing themselves for pregnancy, this is still absolutely worthwhile, and they'll gain a lot of benefits.
If I can make a little comment, and also fertility therapists, either natural therapists or medical, I think that would be very welcome in our retreat. In the previous one, we had quite a big attendance of either doctors or natural therapists who attended. This retreat comes with a certificate and CME points for CPD. So I think it is important for also like-minded trainers or potential trainers or therapists or healers to join and perhaps exchange best practices. They're not coming just to learn, but they're coming to teach us as well. So they're very welcome. So this retreat is also directed to like-minded visionaries, if you like, of natural and conventional medicine.
Thank you. Very good point. And I think that is an area that is growing now, because there are more and more people who are offering fertility support. And this is an ideal opportunity to extend their knowledge. So thank you very much. We did have a question in about the retreat itself, asking us whether we ever hold these at different times of the year, whether they are ever longer than 3 days. And as you mentioned, this is the second retreat that has been held. So I'm guessing there may be plans for another one in the pipeline, but this is the only one available for booking right now. Is that right?
Carolina,
okay, thank you. I was watching Sarah for an eye contact. Yes. What's for sure is that we all focus on this one in October now. We sure hope to have one, and we really prefer autumn and spring. These seasons are friendlier and easier to travel. Of course, you can understand that to bring all of you experts together, and you're so busy. Claire's traveling around the world. Sarah, Elias, Gordon, you're full of lectures. So there are many issues that need to be taken care of for another one in spring. The sure thing is that we're doing this one in October. We're very happy about this. And then we'll see. Hopefully one in spring, but I'm not sure yet. No dates are to be announced yet.
But October, what a beautiful time of year to be
excellent
flying to Greece and having some last sunshine before winter sets in.
People are still swimming, you can imagine.
Oh, not right now, not here in the UK when everyone's putting their heating on now. No, I can't imagine.
That's too soon for us.
Yeah, so what a wonderful environment to hold a retreat. It's going to be a very special experience. I'm just checking if we have any other questions that have come in. I'm seeing that some questions are coming in from the chat. No, I think we've answered all questions so far. Getting lots of positive comments, so that's really good to hear. Thank you very much. I'm pleased this has been useful for you. So do remember that all you need to do as your first step, if this at all interests you, if you're not yet sure which flights you get or how you get the time off work or anything, don't let all of those details get in the way. Just make that first step towards getting in touch. Send us a quick email to info@alphazita.com just to register your interest before tomorrow, Tuesday, the 11th of September. And then if you do go ahead and you confirm your place with us on the retreat, you will receive that discount, £100 for singles, £150 for couples, and that wonderful package of resources that, as you can see, will really deepen your experience and lengthen your experience as well. There'll be things that you can take home, you can continue to use, contact that you'll continue to have with the team long after the retreat has finished. So thank you very much once again to everyone who has joined us this evening. It's been wonderful to spend this time with you again, and great to see so many of you signing up for this information. We know that it's the way ahead in fertility care. We know that it's going to change. You know, the landscape is changing. It's not going to be medical clinics and natural practitioners working separately. They will come together, and we feel as if we are leading the way. So we'd really love to welcome you as a pioneer and enjoy that experience with us and see what the benefits are to your fertility. Has anyone else have any last words they'd like to share with our listeners this evening?
I would like to thank everybody and thank the listeners, thank the panelists, and thank all the visionaries who share this vision. You're not alone. You have been lonely, but you're not alone. There are some amazing people to help you. Please look out, reach out for them, and there's always options. Science and technology have moved forward, and I think alongside we should pull people together like yourselves who would look after the rest of the body, the rest of the soul, and the spirit. Thank you so much for being part of this team. Thank you.
Thank you, everyone, for listening in. Thank you for joining us, and hopefully we'll get to meet you in Greece. Take care, everybody. Bye-bye.
Good night, everybody.
Good
Bye.
night.